Marvin Gaye, what is going on, ladies and gentlemen? Today, we gonna talk about the C word. I don't mean that C word, so chill your gills, all right? There's a lot of stuff been going on about this coronavirus, so I felt like, let's talk about that. There's a lot of information going around, and let's just cut right through the fat. And let's talk about it. So, what is it? What is this coronavirus? Well, it's a coronaviruses are like a family of viruses that typically live and circulate within animals. They range from your common cold to SARS. We really haven't heard anything about SARS in quite some time, so which is a good thing. But like I said, it's a strain of virus that is more commonly circulated around through animals, and every once in a while. Sometimes they have these spillover events where they get transmitted to humans, and I heard about the bird flu. It's kind of the same thing. So we all know that it started in Wuhan, China, at one of the local markets from animals. And in January 21st, there were 282 confirmed cases. February 7th, there were 31,211, and March 2nd, there were 87,000 globally. That is something else. They spread to 30 other countries: Japan, U.S., Philippines, Hong Kong, France, Italy, and Taiwan. So, and a lot of people say, well, the flu is worse. Let's not panic. It's the flu is worse than anything that this coronavirus, this COVID-19 is throwing at us. No need to worry about what's going on currently, and it's not necessarily false, but it's not necessarily true either, because at this point, the flu is a lot worse than what we're dealing with right now, but there's a vaccine for the flu. You can go get flu shots to prevent it. If you start coming down with the flu, if you start getting flu-like symptoms, you can go to the doctor. You can get medicine. Right now, there is no vaccine for this coronavirus, for this COVID-19. There's nothing out there. It's still in the early stages. So at this moment, you can't really write off the fact that if it's going to be more dangerous than the flu, if it's going to be as dangerous as the flu, or if it's not going to really be a thing. I mean, if it keeps up the way it is, it'll probably continue to be, where the flu is much worse. But we won't. There's a lot of questions that are still unanswered, and we won't really have those unanswered questions. We won't have them answered until we get a lot of data back. Until then, we're just kind of we're trying to do the best we can, but it's almost a wait and see what happens type of deal. I mean, we're trying to contain what's already been out there. We're trying to treat those that haven't. We're trying to prevent those that have not got it from getting it. But as far as saying, the flu is a worse deal than the coronavirus, than everything that's going on right now, again, you're right, but you're not wrong, but you're not right type of thing, So the flu, has a mortality rate of 1%, and at the epicenter of this outbreak, they had a mortality rate of 2%. But that was at ground zero. That was at the Wuhan district. So, and it's almost that something like that is going to have more of an impact where at the origin of where it started. That's what origin means. It's going to have a greater impact where it started than as it spread than it would as it spreads out. But, right now, the only people that are really at risk for this are one, the elderly, because their immune system is starting to diminish. Those that may have immune deficiencies, those that their immune system is not as strong as a healthy human being might be. Those are the ones that are more at risk. Some children have gotten a hold of this, and that's because their immune system hasn't fully evolved yet. So I mean, they could be at risk as well. You're talking about a mortality rate. SARS had a death rate of more than 10%. So there's that. But I want to I want to discuss like an elephant in the room, because I saw there's so many people walking around with surgical masks or with face masks, these N95s. And listen, it doesn't matter what news source you look up, what media outlet, it doesn't matter who you get your news from, whether it's YouTube or wherever you get it from. Everyone is telling you that if you are not sick, do not wear a face mask. Do not put a respirator on. Most people are not trained and know how to put one on and how to wear it properly and how to leave it the hell alone. Because once people put it on, they're not used to having, this mechanism on their face. So they're going to be playing with it. They're going to be moving it. They're going to be adjusting it. And then once they get adjusting it, once they move it, they're playing around with it. They're getting all the germs and everything, all the sick germs all in their hands, and then they're touching their face and their stuff that they're carrying or holding, their loved ones. And then they could be contracting some disease and spreading it to someone else. So it's just, if you're not sick, don't wear a mask. I see people all the time in town, in the city, they'll wear a mask, but instead of it being like this right here, it'll be like this right here. And it's like, what are you doing? You're not wearing that properly. So just, and if you don't know how to wear it properly, don't freaking wear it. One, it's not an ironclad 100% fail safe that you're not going to get sick because you're wearing the respirator. You could still get sick while wearing that respirator. I mean, for one, the surgical masks do not do anything at all to prevent anything from entering your system. Okay? And these N95s, all these do, these N95 respirators are particulate respirators, which means they protect you from 95% of the particulates in the air. But when it comes to people sneezing or people coughing, when these aerosols get transmitted through the air, your respirators, your masks are not going to protect you from that. You can still get sick even though you're wearing a respirator. So what you're really doing is you're taking away resources from people that actually need stuff like that, because they're actually working with people that are sick from on a day-to-day basis. And again, even that is not a fail-safe, but it lessens their chance. But if you're not sick, you don't need to wear one. You shouldn't wear one, because chances are you're just gonna make yourself sick because you keep fooling with the freaking thing. And again, it doesn't matter where you get your news. Everyone is gonna tell you the same thing. If you're not sick, don't wear a respirator. Don't wear a face mask. And especially if you have a beard. If you have a beard, you might as well just don't. You're not going to get a good seal around your face for that respirator to actually work. So just don't put it on. If you're not sick, wash your hands continuously throughout the day. If you can stay, I think the CDC, they said to maintain like a 5 feet distance from other people if you're able to do that. But if you're sick, that is a perfect example. That's a good time to where you would want to wear a mask. And even that, all that is doing is just lessening the exposure to those that are around you from getting sick of what you have. So if you're sick, if you're coughing, if you're hacking, it's still not going to be 100% fail safe where no one's going to get sick around you, but it's going to lessen the chance of people getting sick around you. So if you're not sick, don't wear one. If you are sick, you wear one, but don't wear a freaking surgical mask. Are you kidding me? Those don't do anything. You are more likely to get infected by touching contaminated surfaces than you are one of these, aerosol droplets, flying through the sky, flying through the air. So if you're just walking around town and you're not in close contact with other people, then you are most likely fine. Wearing a mask is unlikely to really make any difference at all. So you shouldn't wear one. Is basically what I'm trying to say. I've kind of already said it about several different ways. So the big question is, what do we do to prevent ourselves from getting sick? And it's pretty much just basic hygiene and proper etiquette. And there are a lot of people that need to hear that, because when you cough or when you sneeze, I don't know how some of these people were raised. Listen, cover your mouth. Cover your mouth. If you sneeze, if you cough, don't cover your mouth with your hand. Bury your mouth into your elbow. You know, sneeze or cough like that. But don't just, don't just cough out into the atmosphere for everyone to get freaking engulfed by your aerosol contamination. But there's a lot of people that need to hear that. I don't understand how some people are raised. Just coughing on people, coughing and sneezing on each other. No wonder so many people are sick. But then also just washing your hands, continuously throughout the day, depending on, whatever you're working on, wherever you are, you want to make sure you're always washing your hands. And that's another thing that a lot of people need to see. Let me tell you something. Some men, listen, some of you guys are just are disgusting. I can't say anything for the women because I'm not in the women's bathroom, because I'm a man and I identify as a man, but so I can only comment on what happens in the men's bathroom. But when you come out of the bathroom and dropping the kids off at the pool, and you walk out of the bathroom, you ought to be slapped, because that is disgusting. When you're at the urinal doing your thing, and then you just go and wet your hands with water and then dry them off and walk out the door. There's things that make you go buh. But yeah, you just wash your hands and practice proper etiquette. And then also, if you're eating meat, or actually not only if you're eating meat, just make sure you're not eating anything that's undercooked. Make sure everything is thoroughly cooked. So for right now, there is no pandemic and there's no need to panic. The World Health Organization, the WHO, defines a pandemic as the worldwide spread of a disease. So, it started in China, and it's left China, and it's in 30 different countries now. But that is not unexpected development. That's not unheard of. So it's not, to the WHO, that does not classify as being an outbreak, but a pandemic. The WHO has declared the outbreak, because I just said it's, but the WHO has declared the outbreak to be a public health emergency of international concerns, basically because of how transmissible it is between people and what proportion become ill and end up in the hospital. So the good thing out of all this, and this comes from the WHO also, is that the more easily a virus is to spread, it usually tends to have a milder impact. So, we have that going for us. But, listen, I'm not saying, I am saying don't panic. Even WHO tells you not to panic. Right now, there's no clear understanding of what's going to happen. It could be worse than the flu. It could be, less of a thing than the flu is. So just when you go out in public, try to minimize interaction with people, or try to minimize, maximize your distance between people. Wash your hands thoroughly. Take some hand sanitizer with you. Just be mindful of your surroundings and those that are around you. And just look out for yourself, look out for each other, take care of each other, and really you should be fine. I'm not going to say you're not going to get sick. You may still get sick. You may not get sick with the coronavirus, but wash your hands, look out for each other, and you should be fine. Right now, there's no need to panic. If anything develops, maybe I'll do another video and discuss it then, but it's the thing that we're experiencing now. Every so often we have some kind of outbreak. We had the bird flu, then we had Ebola. That was a thing in the States that didn't really become a thing. So, who knows what's going to happen with this? So I would just sit back and relax and just be mindful of the situation, understand the ongoing developments, but just watching what you are doing yourself. Take care of yourself. Like I said, wash your hands, cover your mouth when you sneeze, when you cough. Inshallah, everything should be fine. All right? Listen, if you like the video, consider giving me a thumbs up and comment down below. I would love to hear what you guys' thoughts are on this. I would love to hear, if you think that we should write this off to being nothing more than, what we're already experiencing now with the flu, or if we should pay more attention to the flu or less attention to this. Regardless, let me know how you feel. Let me know what's going on in your mind. Let me know if you guys have any questions. I will try to answer whatever I can. I may have to do some more research of my own, but it is what it is. Let me hear from you guys. And if you like the video, if you consider sticking around and hanging out with us, consider hitting that red subscribe button if you think that that'd be cool. I think that'd be pretty cool. So go ahead and do that. I'll wait for you. I gotta go to bed soon. I can't wait all night. Listen, hit that red subscribe button. I'll put out new videos every week. And just stick around and see what happens next, all right? Ladies and gentlemen, as always, take care of each other.